How will we address TMJ, temporomandibular joint problems? How will we address TMJ in our office? Well, one of the things we're going to look at particularly is muscular balance and how well the nervous system is controlling that. So we're going to have a person open their mouth, and then we're going to do a muscle test on the TMJ where we're going to touch the TMJ, and then we're going to see if the nervous system changes by a muscle strength test changing. We're going to test that jaw in 9 different positions. Now I can't do that with everything here, but we're going to test open slightly side to side, open wider side to side. We're going to test the jaw going forward, the jaw coming back, puckering the lips and blowing through in 9 different total positions. We're going to test that TMJ. If that's off, then we're going to release the cranial area, and we're going to do a very gentle adjustment where we lightly hold the cranial area and lightly hold here and release the dura, or the coverings around the brain and spinal cord, so that the brain can get reconnected with the TMJ joint again. The other thing that we're going to do with the TMJ problem is we're going to test not only the mandible here, but we're going to test the temporal bone here. And we can test that by putting a light pressure here and see if we get the nervous system reacting, either with a muscle test or with checking at the base of the skull for a response in the muscles. And then we're going to be able to adjust this TMJ very lightly. We use a super gentle instrument that just taps in here really light, and it's extremely precise, and we could get actually on the joint itself if we needed to. But often we find the problems are here at the temporal bone. Then we're going to have a person chew and do the same testing and see if anything is off, and if it is, then we'll reset it either with the cranial adjustment or with the instrument. And we have to realize that a lot of TMJ problems don't always come from the TMJ. Some of the problems come from the upper neck, because if we think about it, our upper neck and our TMJ are this close together. So the top vertebra in our neck and our TMJ are just right here. So very close together. So some problems could be coming from the upper neck. Some problems can come from as far down as our sacroiliac joints near our tailbone. What happens is if there's a weight-bearing misalignment in that sacroiliac joint, and I discussed that a couple videos ago, that misalignment will create compensating muscle reactions that go up the spine and end up at the TMJ. And so there's several patients have been referred to me actually by other chiropractors who said, I've just done everything I can to resolve this TMJ problem with it. I can't find it. And we found it at the sacroiliac joint, causing compensating muscle reactions up the spine. So those are some of the things that we do for TMJ issues in our office. And of course, we may use nutrition or other things to strengthen the tone around that joint. Those are the things that we can do to help a person with temporomandibular problems who may be experiencing jaw pain when they eat. They may be experiencing a lot of popping, just a lot of tension that may cause headaches, many other issues. So if you're interested in more information like this, be sure and see some of our other videos related to our chiropractic techniques or to quantum neurology. I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined. Please like us on Facebook and subscribe to us on YouTube.